One in every three adults have varicose veins, especially after 40. Varicose veins are not just a cosmetic issue. They cause problems later in life, like ulcers, clots, and even life-threatening complications. That's why I will tell you everything you should know about varicose veins, how to detect them, and how to treat them effectively. The earliest sign of varicose veins are heaviness and tired legs after standing or long walking, evening swelling around the ankles, which improves by morning. Other early symptoms are mild aching, throbbing, or warmth in the calves, and sometimes night cramps or restless legs at night. Itching or tingling around the ankle can be a warning sign of later skin changes in varicose veins. Varicose veins are usually visible themselves as a bulging, twisting blue veins appear especially on the calves. Spider veins are common also, and reticular veins, they look like blue-green lines on the legs. Sometimes there is persistent swelling that does not go away in the morning. In later stages, skin darkens on the shin and ankles. Sometimes eczema-like itching or redness occurs, called varicose eczema. Over time, skin becomes hard and shiny near the ankles. This is called lipodermatosclerosis. Later, as complication, venous ulcers can develop. These are non-healing wounds near the inner ankles. The final stage of varicose veins is ulcers. Varicose veins have 6 stages. Stage 1 is heaviness and swelling at night. Second stage is visible spider veins. Third stage, swelling becomes consistent. And fourth stage is pigmentation, eczema, and thickened skin. And fifth and sixth stages are venous ulcers. Varicose veins develop at different speed. Some occurs after pregnancy and progress within years. Others develop slowly over decades, worsening with age, obesity, and standing working. Without treatment, almost all varicose veins progress from stage 1 to stage 3 within 10 years. Varicose veins develop because vein wall inside the leg fail. Normally, these veins allow blood flow upward toward the heart. When the wall weakens or stretches, blood leaks backward. This is called reflux. It creates venous hypertension, high blood pressure into veins. Consistent high pressure in the leg over time, this pressure causes vein to dilate, twist, and bulge. The longer it persists, the more skin tissue suffers from poor oxygen supply. The root problem is valve failure or vein wall weakness. Varicose veins occur most commonly in women, usually starting at young age. They may notice spider veins after pregnancy and complain leg heaviness. It's common in middle-aged teachers who develop bulging veins in the evening. If we ask why varicose veins develop, usually it's genetics. Genetics play a huge role. Also, hormones, progesterone and estrogens relax veins, which make it more common in women. Pregnancy also increases abdominal pressure, hormones rises, and veins expand. Mechanical stress is important also, standing jobs, obesity, heavy lifting, and aging. During aging, collagen loss, vein wall degeneration happens naturally. Women have 2 times more varicose veins than men. People with varicose veins have 5 times higher risk of deep vein thrombosis. They also have a greater risk of pulmonary embolism later in life. They have risk of venous ulcers eventually because of venous hypertension, skin breakdown, and non-healing ulcer develops. We call varicose veins when subcutaneous superficial veins are dilated more than 3 millimeters. They are visible, palpable when standing. The diagnostic criteria are they should be visible on the leg. Symptoms like heaviness, swelling, cramps, itching, or skin changes. And by duplex Doppler ultrasound, very commonly used, and reflux should be confirmed. Varicose veins and chronic venous insufficiency are related conditions, but they are not same. Veins insufficiency is broader condition when valve failure causes chronic venous hypertension, which then causes varicose veins. So varicose veins are the early visible signs of chronic venous insufficiency. They are the most common manifestation of chronic venous insufficiency. Its entry point into chronic venous insufficiency. Treatment is important, not only medications, but also lifestyle measures. The first and one of the most important is weight management. Even if you are slightly overweight, you have an increased risk of progression of varicose veins around 25%. Physical activity is important. Daily walking around 60 minutes improves venous return because calf muscle pump blood. Calf act as a second heart, reduce reflux and pressure. Avoid prolonged standing or sitting. Move every 30 minutes. Leg elevation is preferable for 10 to 15 minutes several times per day with feet above the heart level. It reduces venous pressure. Compression stockings are also part of treatment. 20 to 30 millimeter mercury. They are not only for cosmetic but functional also. They reduce venous hypertension and swelling. They relieve symptoms in about 80% of cases and slow progression if used regularly. From medication, diosmin hesperidine is important. It improves venous tone, reduces venous capacitance, and improves lymph drainage. It relieves heaviness about 70% of patients and reduces ulcer reoccurrence around 40%. The intake is 500 milligrams 2 times daily or 1000 milligrams once daily. It requires long-term intake from months to years. Usually safe. Horse chestnut extract is also effective. It inhibits capillary leakage, reduces edema, and has anti-inflammatory action. The doses is 300 to 600 milligrams daily divided into 2 doses. Intake duration is 12 weeks, generally safe, but in rare cases can be hepatotoxic, so avoid in severe liver disease. Pentoxifylline is another option. It improves microcirculation, reduces blood viscosity, and improves tissue oxygenation. It is more effective in case of venous ulcers. Toxides like troxarutin are also used, strengthen the vein wall and reduce capillary leakage. They relieve symptoms in about 60% of cases. Dose is 1000 to 2000 milligrams divided into 2 doses. Usually safe, not strongly recommended by guidelines, but still acceptable. From procedures, endovenous ablation with laser or radiofrequency is used and is considered most effective and definitive treatment. It closes the vein and removes reflux. The success rate is about 95%. It is disease modifying and stop progression of the disease. Also, foam sclerotherapy is successful treatment and surgery is used when ablation is not available. And now let's say about creams which are used in varicose veins. Unfortunately, they are not effective. They have some effect, but they does not stop progression of the disease, but they give symptom relief. Troxarutin gel is common. It reduces heaviness around in 50% of patients. Heparin gel is also effective some level. It has anti-inflammatory effect and reduce local swelling. And horse chestnut extract gel and diosmin hesperidine, they reduce heaviness but weaker than tablets. So generally these creams are less effective compared to oral medications. The most effective exercises for varicose veins are walking, calf raises, cycling and stationary bike, swimming, and ankle flexion and extension. If we say what measures can reduce progression of the disease, most important is compression stocking, which slow progression of the disease, daily walking, and also leg elevation and weight control are the crucial steps. We should watch progression of the disease. Stage 1 and stage 2 are when you have visible bulging veins or spider veins, and heaviness. Stage 3 and 4 are swelling becomes permanent and skin darkens and eczema appears. And stage 6 is when ulcers occurs. Red flags are when evening swelling no longer disappears by morning, or when there is itching, eczema and around the ankles, and dark pigmentation of the lower leg.